So a big question that I often get, and a question that I see online a lot, is how many C-sections can somebody have? We're going to go through that in this video. My name is Eric Schmidt. I'm a board certified OBGYN, part of the new school OBGYN where you get your information matters. So in this video, we're going to be talking about, well, kind of an interesting question. And it might not be what you suspect, because I've heard, maybe somebody can only have 3 C-sections or 5. Well, what is the answer? So let's first go through what plays into our mind when we decide how many C-sections somebody can have safely. So let's help illustrate the different layers that we're going through during the C-section, because each of them might have a different role in somebody's risk when it comes to having repeat C-sections, okay? So uterus here, the vagina down here. This is kind of going to be a side view, okay? And so pregnancy inside the uterus here, and obviously this is not drawn to scale, but so when we're going and doing a C-section, for whatever reason that might be, there is skin layer, there is the subcutaneous or fatty tissue layer, and the core rectus layer. And so skin, subcutaneous, we'll call this the fascia, and the muscle. Okay, and then we're getting in by what's called the bladder is on the lower part of the uterus here, and we'll label that bladder, okay? So often when we're starting our C-section, it's right there, and we're gonna go through these different layers. So why would somebody say there's a limit to the number of C-sections you can have? Actually, I'll give my answer towards the end, whether it's 3, 4, 5, 6, 10. And so right now, let's just talk about what plays into those decisions, okay? And so it's the scar tissue at each of these different layers that it can increase somebody's main risk. That's the first point, is scar tissue. And so scar tissue isn't like our normal tissue. It can form on the layers of the skin. It can form not as much in the subcutaneous tissue, but it can. The fascia can definitely have increased scar tissue here. And sometimes the fascia and the muscle can become completely stuck to the uterus, and this can make it definitely more difficult, definitely takes more time, more dissection time, potentially more bleeding. And so that's another point. There's an increased risk of potential more bleeding with the number of C-sections that somebody may have. Okay, and that can occur at any different layer, including the uterus. If there's a lot of scar tissue or thinning there at the uterus from the repeat C-sections, that can impact the way that the uterus normally stops its bleeding, because the uterus during pregnancy has a lot of blood flow to it, and its normal mechanism for trying to stop the bleeding associated with delivery, and even in C-sections too, another form of delivery, its main mechanism to stop that is by squeezing, okay? And scar tissue, the area doesn't stretch, doesn't squeeze as well, so potentially maybe somebody might have that increased risk of bleeding if they have more scar tissue in these layers, specifically on the uterus. Another thing that someone may be at increased risk with a number of C-sections would be infection. In these different layers, their blood flow might not be what it normally was, meaning it might be harder for the body to get its own defense mechanisms against infection there, giving that potential infection increased risk. I would say overall this risk is still low, but definitely increased over the average person. And another big point that we often see is that somebody may have an increased risk of incidental damage to the surrounding organs that may be down by the uterus. And so specifically, some of these things might be, well, we illustrated it earlier, the bladder. This normally hangs out low, just above the area where we normally make the little cut to get your baby out. But after that first C-section, scar tissue and damage and healing to that area causes inflammation, which causes things to stick. And so often what we can see is the bladder can try and move up the uterus, potentially sticking to the mid-uterus. We see this in repeat C-sections. I might see this in surgeries for a different reason later down the road, but we definitely are more careful because this bladder, as we're trying to go through these different layers, can try to be in that area. We'll pull up this table now, but as somebody is having increased number of cesarean section births, you can see the different risks or major risks that can happen during a C-section here. And cystotomy means an opening of the bladder. In this case, it would be incidental. But you see that overall risk and percentage is so low for the first few C-sections. And then you start to see it bump a little bit to 1%, and then at the C-sections it's up to 5% because that bladder has such a tendency to stick up higher on the uterus with more scar tissue with more C-sections. There also could be potential other organs that are damaged during the time of the C-section. And again, on this graph here, it lists bowel injury. The bowels generally hang up, on this part, and they can potentially stick to the uterus. It was pretty rare that bowels interrupt a C-section because they're so low, but it is a potential risk. With all this being said, this sounds totally scary right now, me explaining these serious issues that can happen during a C-section. But once again, this is not my goal. It's just to be transparent on the things that are going through your provider's mind when they're trying to make up the safest plan for you and your baby. Because definitely recently I've done somebody's sixth C-section. And they had minimal to no scar tissue in these areas. They had a lot of thinning of the fascia and the muscles because those areas aren't healing as well. So there was definitely thinning, but there was no significant scar tissue to any of those areas, and the delivery went perfectly fine. But there are definitely cases where somebody's just going in for their first repeat, or what would be their second C-section, and they have a significant amount of scar tissue. And so what I'm saying is that, number one, it's hard to, really put a number to it, but also we always go into a C-section or something like that prepared for, the potential worst case scenario, pleasantly surprised when it's easier than expected. But, these are definitely going through your doctor's mind potentially when they're discussing these things with you. Some other issues that can arise and that we see on this chart that I showed earlier are that there can be issues with the placenta growing later on. Now, when somebody has scar tissue, again, inside the uterus here, the placenta, which goes to the umbilical cord and baby survives off of for the duration of the pregnancy, at least the latter half, not the first few weeks, but the placenta likes to normally just stick to the smooth area. However, early on in development, if by chance it starts to develop on that scar tissue is kind of gritty, it's kind of stickier, and so it's a potential chance that placenta might just stay there on that scar tissue. And since it's irregular, since it's not normal, smooth part of the endometrium, it has a potential chance of causing more issues, which would be like potential invading into the muscle. This is called a creta. Now, this can be a very potentially serious complication, and one of the most serious, actually, complications during a pregnancy because of that invading placenta into the uterus muscle can cause significant issues around the time of delivery, too, because it doesn't simply peel off the inside layers like the smooth layers. It might not be able to come off. And again, this blood flow around the pregnancy is potentially taking 20% of a mom's blood flow. And so those are some serious situations which can cause somebody to have increased risk of hemorrhage. Quite often hemorrhages happen with that, likely needing transfusions. Potentially, sometimes even if you hear somebody having a story of maybe needing a hysterectomy at the time of their C-section, it potentially, and there's a good chance, it may be from this issue. And so that can increase as somebody is going through the number of C-sections. Again, very rare after the first repeat, second repeat, even the third repeat, but you start to see that significantly and exponentially increase with the number of C-sections somebody has. And in their sixth, you see that that is up to 6%, which is not insignificant. That's actually it's actually a pretty serious number there. So the big question is, what's my number? How many C-sections do I let my patients have? Well, turns out I don't have a number. And so it's actually just a discussion, a presentation of the risks with patients on, what significantly increases the more C-sections you have and what risk that individual is willing to go through, okay? Now, if they are having 6, 7, 8 C-sections, I don't say they can't have more. I might advise against it, but I'm never going to tell a patient you can't do it. Now, again, there's other factors that play into this. Number one, we live and we are very lucky to be in an area where we have a lot of access to things such as blood for riskier deliveries, higher risk hospital centers. Now, if somebody is in an area where they don't have these resources, and definitely I've heard of this in other countries where maybe they don't have the resources that we may have at this time, and so they might restrict somebody to 3 C-sections, okay? And it might not be a mutual discussion. It might be, no, you're done after 3 because of these risks. As you start to see on this chart, after 3 C-sections, after 4 C-sections, some of those risks really start to go up exponentially. Okay, I hope this helps answer some of these questions. Again, thanks everyone for watching. If you don't mind, follow along, subscribe, like the video. We'll be coming out with a lot more in the near future.